rural settings where they just don't have a physician, or they don't have like qualified specialists and the like, or access to specialists. All of that is going to be helped a lot by telehealth. I think that part of what we need to have is, the regulatory environment around that and the licensing and all that, and reimbursement systems need to reward that. But I think that change will come. It does seem like we've maybe slipped back a little bit as the immediate crisis has eased. But change moves forward in these sort of step functions here, and so I think long term, it's a real positive for healthcare delivery. It also envisions, frankly, the healthcare system was not devised very much with patients in mind, right? It was devised with the healthcare workers in mind, particularly like around the needs of the physician, like bring everybody into this one spot, have them sit around and wait and disrupt their day. What a great solution to have for at least the things that don't require that hands-on in-person things, that just like a brief conversation with a caregiver. I think that if we can get the reimbursements and the regulations right around all of that, it's going to be a huge upside for the healthcare system, particularly in a time of talent shortage. And just to add on top of that, if we can figure it out, there is a whole global labor force out there, and we're seeing this across the economy. And healthcare gets, a little bit more problematic, maybe, but I think we'll work through this over time, and the ability to leverage workers, across state boundaries or across national boundaries as well, I think is a positive thing for being able to take care of an aging population in a situation where we're really constrained in terms of the workforce.
I really like the premise around how we don't necessarily have a healthcare system that was always patient-centric. And now it's almost like we've talked about the demands from the workforce, but there's also demands from patients, right? Because most healthcare plans now give them the option or the opportunity to do telehealth or to go in person. And I think after the pandemic, most people didn't want to go into an office full of sick people if they just needed something checked versus, man, I need immediate care or an urgent care situation. So I love the possibilities of bringing kind of the hospital or care from the home and allowing people to even think about how patient care is delivered. And to your point, then that opens up the possibility of all these beautiful skill sets, diversity, and competencies that may not exist in one area or one city. And now we have the access to go talk to the specialist who's in Italy, who can absolutely help us diagnose this situation. So I love the fact that you mentioned all of that.